In our pet segment this morning, surgery in your pet. Hopefully it doesn't have to happen to you or your pet. Well, joining us now is Dr. Tony Kremer with a little bit more. And
Morning.
Maggie.
This is Maggie, yes.
Who's recovered from heart surgery, is this
She has today. She's a healthy 6-month-old shepherd mix in a wonderful family, but her road to this point was not all that easy. She had a little rough go when she started. She started out as a homeless orphan. She was taken from a home from a neglect case, just like a scene out of Animal Cops, and wound up in the Humane Society of Plainfield, where the veterinarians diagnosed her with a severe heart problem.
At 6 months?
Well, this was
4 months.
Yeah, this was when, yes, when she was a little bit younger. But anyhow, she had this terrible heart problem, and you know, some lucky dogs get to have this repaired, and she's one of them. And the problem she had is kind of a mouthful. It's the patent ductus arteriosus. Big, huge word there. And
heart problem sounds good to me.
We call it PDA for short.
Okay,
so
good.
basically,
PDA.
What that is they have a little vessel in their heart when they're puppies and inside their mom.
Now we have the X-ray right over here. Is this something that you can show us?
Sure.
You were able to spot it in X-ray at least at first?
Well, most likely through ultrasound and some other things, you find that they have it. But this shows basically in her heart that there's actually a little coil they put in there. And the bottom line with that is once they find out they have this little vessel that's not supposed to be there, they put a catheter in their leg now, and they can put this in. Oh, it's okay.
Maggie, I know it hurt, but you're better now, right?
And the coil opens up, and it blocks off that blood vessel, and the blood goes back to their lungs like it's supposed to.
Yeah, I think we have some pictures of the coil actually going there. And that's the key to fixing exactly what kind of problem.
What happens is this vessel is basically very important when they're still in the mom. It diverts blood away from their lungs, and because they're not using their lungs. But when they're born and they start to breathe, it's supposed to close off on its own. And in a dog that it doesn't, the blood's not going where it's supposed to, and they become very lethargic and tired. And a lot of times, they have a very short lifespan if they don't have it repaired.
And that's the key, because a puppy would be jumping around. So if you have a puppy that's a little lethargic, this may be something to look into?
Something to check into. And most veterinarians can kind of hear there's a problem with a stethoscope. It takes a little bit more diagnostic work to prove it. And then, like I said, once they find out they have it, they need to be in a hospital like the University of Illinois, which is kind of like the Mayo Clinic for pets, you know. They do some amazing things there.
Maggie, everyone's paying attention to you.
And they did a wonderful job with her, and since she was a Humane Society animal, they did a reduction in the cost. They were terrific.
Beautiful.
And now she's in a wonderful home with a family that decided to adopt a special needs shelter dog.
Oh, well, thank you. Hey, we do have the phone number, too, of the Chicago Veterinary Medical Association. It is 630-325-1231. Thank you so much for being with us. I appreciate it.
You're welcome.
Maggie,
thanks for having us.
Give me 5, Mag. Try it. Okay, you got it. Anyway, very good. Obviously, he looks pretty healthy through going all this.
She's doing great now.
All right. Back to you, Anita.